myself. I work for the Schmieding Center for Senior Health and Education, and part of my job there is to work with family caregivers, and we work with a lot of family caregivers of people with dementia, but also just family caregivers in general. And we have certainly noticed since March, when COVID sort of started taking over our day-to-day lives, we have had just a different sort of set of caregiver needs. And so that's why I felt like it was important to just come out here and talk about caregiving and what some of the caregivers are facing, and just introduce some of the questions that we have been getting from caregivers, and maybe that would be helpful to other people who are watching as well. This first slide is just our UAMS disclosure policy. We are obligated as UAMS employees to let you know that we have no financial stake in anything that we are talking about. So my PowerPoint is pulled up over here on my second screen. So if you see me glancing over, it's because I'm looking over at that second screen. I just want to take a few minutes to talk about how the role of family caregivers have changed during COVID-19, or some of the things that we are seeing as professionals who work with family caregivers. Now, one of the things that has certainly happened is that caregivers who maybe were working part-time or full-time, they are now working from home, or they're staying at home with the person that they were taking care of. And that certainly changes the dynamic of that household or of that situation. When a caregiver has been used to getting out of the house for a few hours every day, or maybe they had someone coming in taking care of their loved one, and now they're spending 24 hours a day, 7 days a week with the person that they're taking care of, that certainly adds an extra layer of stress to that relationship for both people. So both for the caregiver and the person who's being taken care of, if they are not used to being around that person all of the time. So we have been getting some phone calls from people that I don't know what to do. I need some extra support because I have been working at least part-time, and now I'm home with my husband, and now I realize that I am not cut out to be a full-time caregiver. I just can't keep up with all of the questions that he's asking. Or now that I'm home with him, I realize that maybe he wasn't doing as well during the day as I thought he was when I was leaving him by himself. And so now I need some extra help. And certainly that's a very real consideration for caregivers. We touched on this just a little bit. Caregivers who are not able to leave the house or participate in some of the social activities that they had done before. So we will certainly talk about tips for caregivers later on in the presentation. But one of the things that we always recommend to caregivers is to take a little time for yourself. And so caregivers who are used to doing that, they're used to going out and playing cards with friends, or meeting for coffee with gentlemen from the church, and now they can't do that. So again, they're at home 24 hours a day, 7 days a week with the person they're taking care of. And so that adds that extra layer of stress, extra layer of anxiety, when there's just not that opportunity to be able to take a break. No or limited outside help coming in. So, as you can imagine, for a lot of caregivers who are having maybe outside home care agencies come in, or private caregivers come in, in March, that just changed everything. We started to become more fearful about who we're letting into our house. And so many caregivers have either chosen not to have someone come into their home to help them, or their caregiver has chosen not to see all of the clients that they were seeing before. So now this person the caregiver is now taking care of their loved one 24 hours a day, 7 days a week, the physical care and the mental and emotional care of that person. And so those of you who are caregivers and who have had outside help coming in, you know how invaluable that is to have someone come in and do those physical activities. Those are probably some of the most difficult and heartbreaking stories we have heard come in, is people calling saying, I had to let my caregiver go because I'm just fearful about them coming into the house, and they're going out and seeing other clients as well. And I love her, but now I am trying to figure out how to get my husband to the bathroom and how to get him a shower because someone else was coming in and doing that. And so it becomes very stressful mentally, but also physically on that caregiver, because they're not used to doing some of that lifting, or maybe they can't do some of that lifting. And so now the situation has kind of changed to, now I can't do everything for my husband or everything for my mom that needs to be done. And so they're are a lot of feelings of guilt associated with that. And I really want to talk about that. We're going to talk about tips throughout the presentation. But, you know, caregivers, you can only do what you can do. You know, you are doing the best that you can do every single day. And so, you know, any caregiver in the best of situations, we really talk with you about letting go of those things that just aren't as important, or those things that just don't matter. You know, mom doesn't have to have a bath every day or a shower every day. You know, especially if she's staying in and she's not going out, she's not doing a lot of physical activity, so she's not, you know, getting sweaty. You know, and I know people always bring up incontinence. Well, she's incontinent, and so I feel like she needs to take a shower every day. You know, give yourself some grace as a caregiver that you may not be able to do everything just perfectly. We set very high expectations of ourselves as caregivers, that we want everything to look right. We want to make sure that mom's hair is done. My husband is always shaved perfectly every single day. Those things in the big scheme of things are not as important. So as long as your loved one is safe and healthy, and they're eating a healthy diet, you know, focus more on those things that are directly related to health and well-being, and not necessarily some of those things that in the big scheme of things just aren't as important. Because it's difficult for a caregiver in the best of circumstances to get everything done that needs to be done. So let the dishes go and not worry about that so much. You know, even if they pile up for a few days, they'll still be there. When you need to eat off of them, you can wash them one at a time, and that will be okay. And then don't worry so much about, you know, is everything happening the way it would have happened if I had an outside caregiver coming in? Because it's not going to. And to think that it will is just, it puts a lot of extra guilt and pressure on the caregiver. And then certainly, you know, reach out for help. And I'm going to say that over and over again. You know, reach out for help from professionals or friends when you're starting to feel some of that stress, or you're starting to feel like I'm just not quite measuring up in the caregiving department when I'm having to do it all by myself. Long distance caregiving has changed. So sons, daughters, maybe who are used to coming in and visiting their parents from out of state every few weeks, or, you know, maybe mom lived with daughter in Arkansas for 6 months, and then she would go stay with her daughter in Kansas for another 6 months. Certainly that has changed during all of this. And so maybe someone can't get in from out of state to visit mom and dad, or it's not safe for them to come in from another state to visit mom and dad. And so there's often a lot of guilt associated with what's going on at home. I'm used to being in there every few weeks. Now I haven't been able to see them. I'm not sure that mom is always telling me the truth about what's actually going on with dad. I think that things might be a little bit worse than they thought. You know, and again, you know, give yourself some grace, because you're not, you know, you're keeping them safe. You know, you're keeping your parents safe by not visiting, or you're keeping your loved ones safe by not moving them to another situation in another state. And you may not always know what's going on in the house if they're not sharing completely with you. So, you know, ask good questions, very specific questions. So instead of just, hey, how's dad doing today? You know, ask very specific questions. What was dad's blood pressure today? What was his blood sugar today? Is mom breathing okay today? Did mom seem more confused today? Did she remember who I was when I called on the phone? So asking more specific questions will help them to give you more specific answers. It's pretty easy when you're just asking, how are things going today, for someone to say, oh, everything's fine, or we're getting through, we miss you, but everything's okay. So asking more specific questions will also help them to know that you're really wanting to know that specific information. Certainly one thing with parents is they never want to worry their children. And so they want to make sure, you know, they want to be saying things that make you feel like they're doing okay. So if you're an adult child caregiver, you know, again, ask those specific questions. But if you are a spouse who's taking care of your loved one and your kids are calling saying, how are things going? Your kids really want to know how things are going, and they want to know how to be able to help you. So please help them by sharing a little bit more information about what's happening, so that they can hook you up with resources and things to help. And then certainly, what we hear a lot about on the news is those with loved ones in long-term care facilities who may not be able to go in and see that person in person. That is, again, probably some of the most heartbreaking stories we hear too is just, people who can't get into the facilities to see the people that they love, and they've been used to seeing them every day, and now they can't do that. And it's difficult for the person in the facility as well as the staff, and trying to keep those connected. We have amazing long-term care facilities in our area. So if you are a caregiver who has someone in an assisted living or nursing home, I am in touch with those facilities at least weekly, just kind of checking in, seeing how they're doing. And they are doing a phenomenal job of trying to keep people connected, of making sure that your loved ones are safe. I know that one of the concerns is, I do a lot of different caregiver support groups. And one thing that often comes up in support group when I say, well, how is your husband doing? And they'll say, I don't know. I haven't seen him since March. I think he's doing fine. And so, again, if you're a caregiver and you haven't been able to see your loved one in a facility, keep in touch with the staff and ask them specific questions, because they will often do the same thing that adults or that parents will do, when you call in and say, how's my husband doing today? Because they don't want to worry you, because they want you to not have additional stress. They will say, everything's going fine. He's been up, he's eating breakfast. And so if you have specific questions you want to ask them, be sure you ask those specific questions. Well, what was his blood sugar? Has he been more confused today? To get that information from the staff, and just keep in touch with them. And then as far as with your loved ones, try all sorts of different things in facilities. We know that people have gone outside the window and just visited with people. For someone with dementia, that can be a little bit confusing. We know that they see you outside the window, but they can't quite figure out why you're not coming inside or how you got out there. That can be a little bit confusing. So that doesn't work in every situation, but calling them, doing FaceTime and Zoom. On a personal note, my grandmother has dementia and is in an assisted living facility in Kansas. And we tried a Zoom meeting with her, with all of the daughters and a couple of the grandkids. And that was way too much for her. She could not figure out how she could see everybody on the screen. And then she had it on speaker view. So then all of us would disappear, and only one person would be on the screen. And so it was way too much for her. So we learned that if you can do it one-on-one with her, she's fine, but trying to do it as a group is just too much. So just experimenting with ways that work a little bit better. And also, don't underestimate the power of a handwritten note. We have really, at the Schmieding Center, people that we can't get a hold of, or ones we feel like need a little extra TLC, we've been doing handwritten notes to them. And they love it, that someone took the time to write something to them and put it in the mail and send that to them. So, don't underestimate how important that is to people who are in a facility, to be able to get some mail, to maybe see your picture. If someone has dementia, sending a picture of some things that may have happened in their past. So you as a child, or your wedding picture, something that they can connect with, that you are the person who sent this letter to me. And connect with them that way. It's very difficult for people in the facilities when they can't connect with family members, no doubt. But I think it's often much harder on the caregiver to not be able to connect with the person in the facility, especially if that person has dementia. Their daily routine sort of goes on, and they don't notice the passing of time in the same way that the caregiver notices that passing of time. So again, give yourself some grace if you feel like, I should be up here, I should be standing outside that window every single day. Often the person in the facility doesn't realize that you haven't been there for a few days. So do what you can do, and then just work to connect with them in different ways. And again, talk to the staff, because they are great about helping out. So some other considerations for caregivers. One of the things that we have talked to caregivers about is, how do I keep my loved one safe? So I'm a caregiver, which means the person I'm taking care of, my loved one, probably has some underlying health condition. And so now I am very concerned that if I go out to the grocery store, I'm going to bring something back into my loved one. I'm going to bring something back into the person I'm taking care of. And so, use those things that we have all been using, the grocery delivery, curbside delivery, picking up your groceries, so that you can sort of limit your exposure to some of those things that may put you at risk. And again, it may be impossible to keep someone 100% safe. We just don't know what's going to happen when we go out in public, but do your best, wearing a mask, the good hand washing, hand hygiene, and then just, making sure that you're keeping physicians appointments with the person that you're taking care of as well. And many of the physicians are doing telemedicine and telehealth visits now. So if you have concerns, don't be afraid to reach out to the doctor, because I don't want to take him out to the clinic to see the doctor. I don't want to take him to the emergency room. Reach out to those healthcare professionals. Many of them have alternative ways of seeing patients right now. And then, we talk a lot about the physical safety. How do I keep my loved ones safe? They have these underlying conditions. I'm doing my best to minimize that exposure. But the other thing that we worry about with the people that we're taking care of are the mental and emotional health and well-being too. So how do we sort of balance that physical health with that mental and emotional health? It's hard for any of us to sort of be just stuck inside, or to not be able to go out and do our day-to-day routines. And that is certainly very true of people who are care recipients, people with dementia, people who have some physical disabilities. It's difficult for them to have to adjust their routine too. And that is, certainly a conversation that has come up in many of the facilities. We want to keep them safe, but how do we also balance that mental health and that emotional well-being if they can't see their families, if they aren't able to come out and participate in activities? So for caregivers who have someone at home, sort of balance that physical health and safety with the mental health and safety by doing things like taking a walk or a ride around the neighborhood so that you can social distance. I've been talking to caregivers who say, well, I don't like to go out to walk in the park because no one else seems to physically distance themselves. And so I get a little, anxious about going out. So, find some places in your neighborhood. If you can walk around your neighborhood where there aren't as many people walking, go to a grade school or middle school where they have a track, or maybe they're closed right now and there aren't as many people using that. Just to get out and sort of walk around the neighborhood and get the person that you're taking care of out too. Again, visit with friends or family virtually. Get outside in the yard. Physically distance with friends and neighbors out in the backyard. That's a fairly low risk activity. If you're outside and you're physically distancing, you can visit with people there. Find a project to do together. It's easy to get sort of stuck in the rut that I get up at 7 o'clock every day, we have breakfast, and then we just sit in front of the TV because we're out. Usually we'll go out for a walk, we'll go out for coffee, and so now I'm just sitting in front of the TV. That's easy for any of us to do if we're working from home or staying at home. It's easy to sort of get into that rut. So find a fun project to do together. And for those of you who are taking care of someone with dementia, that project may not be a project that you would have been able to do perfectly prior to dementia, but just something fun that you can all do together. Build a birdhouse together, paint something together, and it doesn't have to be something, again, that's perfect, just something that's fun for you all to do together. Turn off the news when you're worried about how to keep your loved ones safe. We certainly all want to be educated about what's happening with this pandemic, but we don't want to be so inundated with it that it causes our anxiety level to just skyrocket, because it's not healthy if you're going to get up and watch the 7 o'clock news and then you want to watch the 12 o'clock news and the governor's update. Now you're going to watch it again on the 6 o'clock news and the 10 o'clock news. That's so much information, and it will cause you to have a lot of anxiety and then to worry about how do I keep my loved ones safe? How do I keep myself safe? So finding something that keeps you educated about what's happening, but not just inundating yourself with all of that news. Create moments of joy. We often think about how do we make these big memories. Maybe my grandkids were supposed to visit this summer and now they can't visit, and this might be the last time that my family was all going to be able to get together before my husband can't do that again. And so we sort of mourn and grieve those things that we feel like we lost over the summer. So focus on creating those moments of joy, just those little moments that make you happy. So maybe it's not seeing all of your grandkids at once. Maybe it is jumping on a Zoom meeting with just all of your grandkids, leaving the parents out of it and just talking to the grandkids, or doing a pen pal program for the summer with a couple of your grandkids, or exchanging pictures of when you were little with them and writing stories for them. So create moments of joy with the person that you're taking care of, and not worry so much about those big moments that may have been lost when all of these things happened. And it's hard. I know when you are with somebody 24 hours a day, 7 days a week, I heard caregivers say there is no joy left in this anymore. I cannot find any more moments of joy because I'm just so involved in all the day-to-day caregiving. So again, sort of compartmentalize as best you can, and occasionally remove yourself in that caregiver role and let yourself be spouse. Again, let yourself be husband, wife, partner. Let yourself be just son or daughter, and create those moments, because you will look back on this. I know sometimes it's hard to see that when you're enmeshed in all of it, but you will look back on this, and there will be memories that you created, things that you will have taken away from this because you were able to spend time with them that maybe you weren't spending with them before. And then certainly maintain as much of a daily routine as you can. So it's hard to maintain a daily routine, and it may look different than it did before COVID-19, but trying to maintain some type of routine. That's good for all of us to maintain a routine. It just helps the day go a little bit more smoothly, but that will certainly help the person that you're taking care of if they continue to have some kind of routine as part of their day. So what happens if something happens to me as a caregiver? So one of the other considerations, things that we talk a lot to caregivers about is, okay, so what if I'm going out buying all the groceries, or I'm going out to the doctor and something happens to me? Now, what do I do with my loved one? What happens? How do I keep myself safe? What do I do if something happens to me? So this is another one of those sort of catch-22s when we say, watch the news, but don't inundate yourself with the news. This is another one of those where we want you to plan in case of an emergency, but don't focus too much on the what ifs, because you can get bogged down a lot if, well, what if something happens to me? What if my loved one has to go into the hospital? What if my daughter gets sick and can't come visit? So don't jump to all of those worst case scenarios, but make a plan for what if something does happen? What if you do get sick and you can't take care of your loved one? And just as a side, caregivers should have an emergency plan in place, even outside of COVID. What happens if something happens to me? If I have a heart attack, if I get the flu, if I fall and break something, what needs to happen with my loved one? And because of COVID, some of those emergency plans that you had in place may have changed. So for example, your son from California may not be able to come if something happens, and that was your emergency plan. I will call him and he'll come. So talk to someone about helping you make a plan and come up with some things that you can do. Certainly some of the easier things that you can do from home is just making sure that you have listed the person that you're taking care of, listing out all of their medications, their health conditions, making sure that you have a good health record. Because even if an adult child comes there, often very unprepared for what you have been doing every day. They know that you give dad his medications, that you give him a shower, but they don't know what those medications are, what those medications are for, or even maybe what the full diagnosis is. So making sure that you have all of that health information gathered, writing out sort of what your daily routine looks like. So if something does happen and someone has to come in, that daily routine is maintained for your loved one. Reach out to people who are maybe close by, people that you trust, friends, neighbors, other family members, and ask them if they would be willing to come in and take care of your loved one if something happens to you. Gauge their comfort level. We don't want to make a plan in our head but not include the people that we want to come in that plan in case they are uncomfortable doing some of those things or have some more questions that they want to ask. So make sure that that they're also included in that planning phase as well. And then you may need to look at sort of building a team around you, because the person that may come in and help provide the physical care may not be the same person that can come out and do groceries or get food. It may be too much for one person. So is there somebody who can do some of those other tasks for you that are not necessarily directly related to care? And it's much easier to plan now than to wait until something happens and now you have to plan. So go ahead and putting those plans in place is really important. And it will give you peace of mind as a caregiver to know that there is something in place in case something does happen. You know, it's really hard to just sort of wing it, or we'll figure it out when the time comes, because you may not feel like figuring it out when that time comes. And if your loved one does not have dementia and they are able to talk through that plan with you, make sure you're including them in that conversation as well. We don't want them to sort of be blindsided by, okay, our next door neighbor is going to come in on Monday, Wednesday, Friday, and this person's coming in on Tuesday and Thursday. If they're able to be included in the plan, make sure that they know you have a plan in place, and include them as much as possible as well. And then again, don't focus too much on the what ifs. Have a plan in place. Make sure that someone you trust knows where that plan is, phone numbers for people to call, medication lists, things like that. Have that plan somewhere handy. Make sure someone knows where that plan is, and then try not to dwell on what if something happens to me, or what if there's an emergency. So another question that often comes up with caregivers is, what do I tell the person I'm caring for about COVID-19? How much information should I share with them? What should I tell them about not being able to go out? And that really depends on your loved one, on the person you're taking care of, and sort of what that situation looks like for them. So is your loved one living at home with you? That's probably going to be a little bit different conversation than if your loved one is living in a facility. Does your loved one have dementia, or are they cognitively okay? Because that certainly is going to determine how much information you want to give that person. So if your loved one's living at home and maybe they're in early stages of dementia, but can still understand at least some of what is happening with COVID-19, if they have physical conditions that are not cognitively impaired, then it's probably okay to give them as much information as you have. We have to stay home. We can't get out because there's COVID-19 is happening, and so we're trying to be safe. I know this is really hard. I don't like not being able to go out and do these things either. I don't like not being able to have our grandkids come visit, or whatever your situation is. Give them the amount of information that you think that they can handle. But we also know that people who are being taken care of, the care recipients, they can worry about those underlying health conditions too. So again, explaining the information, but not dwelling on the fact that, well, you have diabetes, and so that puts you at really, really high risk. And if you get this, you're probably going to die. We don't want to go that far into the scenario, because that's going to cause them to have anxiety then too, and worry about, well, okay, now I don't want anyone coming in, or I don't want anyone coming out. So, judge based on what you think their comfort level is. If someone is living in a facility, we want to give them enough information to help them understand that you have not abandoned them, that you're not coming to see them because you don't want to. It's that there's this virus out there, and so we're just not able to come into the nursing home right now. We're not able to come into the assisted living, but I still love you, and I will call you, and just giving them that amount of information. If the person you're taking care of has dementia, we almost want to do the exact opposite, reverse that. Too much information is too much information for people with dementia. And even in the early stages, they may have some difficulty processing why you can't do the things that you were doing before. Why can't I go eat at our favorite restaurant? Every Wednesday we go out and have lunch at this restaurant. Why are we not able to do that now? And if you try to tell them that on Wednesday morning, by Wednesday at 11 o'clock, they have forgotten about it, and now you're explaining it all again. So it is okay for those caregivers of people with dementia to use the techniques that we teach, the therapeutic fibbing, the validation, the redirection. So giving them small amounts of information. We can't go out to the restaurant today because the restaurant is closed this week. If they're in the middle stages, it's okay to use that therapeutic fibbing. by next week when they're ready to go out, they're probably not going to remember what you told them the week before anyway. So use that same thing again. Or no, we aren't going to go to church this morning, but let's go for ice cream instead, and then take them through a drive-through and get ice cream, using sort of that validation and redirection, because they can get, it's just too much information often for them to process. And so I know it's very hard for caregivers when the person you're taking care of is asking you over and over again, let's go to the grocery store, let's go to church, let's go out and eat, let's do this. And you have explained to them many times that you just can't go out and do that. So use those redirection techniques, or go for a drive in a car, go for a walk around the neighborhood. Just do something different and sort of start to establish a new routine. Because as that becomes part of their routine, then that will help you as well. So what does all of this mean for the caregiver? So we have talked a lot about all of these different things that caregivers are worried about, and I feel like this has been a depressing presentation so far. I'm telling you all of these things that you worry about, but I also want to make sure that people who are watching who are maybe non-caregivers also realize how important and serious this is for caregivers. Certainly, caregiving is a very isolating type of responsibility anyway, and certainly when you can't connect in a way that you were used to connecting, and that can certainly increase that social isolation, but also increase stress related to caregiving. I'm going to skip over the next slide because we all know what stress can do to our bodies, what that can do physically, and we certainly know that caregivers are at an increased risk of stress and an increased risk of stress-related physical conditions. Cortisol, caregivers have very high cortisol levels often, and so what that really means is that you're always sort of on fight or flight, and so you're always thinking, you're just always on high alert. And certainly having high cortisol levels can do things like lessen your brain circuitry and your brain connection. So having an impact on your memory, on some of your brain connections. So we want to make sure that when we get to this end slide that we're giving you tips to sort of reduce that stress as well. Caregiver burnout versus compassion fatigue is one of the things I really wanted to bring up today. There's kind of a fine line between burnout and compassion fatigue. So we all sort of know what caregiver burnout is. We all sort of know what that feels like. As a caregiver, that is when you get to that point where you call me and I say, this is too much for you. I see it on your face. I hear it in your voice. I know that you're getting burnout. It's those feelings of just being overwhelmed. It's also, irritability and just feeling like I don't want to do this anymore. I'm just being really, really exhausted. And compassion fatigue looks very similar to caregiver burnout, but really compassion fatigue is sort of an emotional shutdown. So it's not just about I'm tired, I'm sort of irritable. One of the signs of compassion fatigue is I just really don't care anymore. I don't care about the person I'm taking care of. I am resentful towards the person I'm taking care of. I don't want to do this anymore. And compassion fatigue can come on fairly suddenly, whereas caregiver burnout sort of just happens over time. We actually talk about compassion fatigue. Another name for that is secondary post-traumatic stress syndrome. And so what happens really is it comes about because you're watching someone else suffer. And so first responders, social workers, nurses, they can also suffer from compassion fatigue. And we're just really now starting to realize that caregivers can do that, can suffer from compassion fatigue as well. So some of the signs are feeling overwhelmed and exhausted, avoidance and just not wanting to be around the person you're taking care of. Your patients are just not there. You have angry outbursts that are uncharacteristic, maybe feelings of hopelessness, increased anxiety, the inability to make decisions, difficulty sleeping. And certainly one of the reasons I wanted to talk about this today is because compassion fatigue can happen in any situation, any caregiving situation, but especially in the middle of this pandemic and some of the other things that are just happening in the world. So we're watching the news and we're hearing other people's sad stories, and we're watching these things happening to people that we know. So, maybe someone from church who has been tested positive for COVID-19. So now we're worried about them, and we're seeing all these other things on TV. And we're taking on so many other people's sadness and stories. And as a caregiver, you already have so much of that sadness on yourself. And so it's easy to become just fatigued and compassion fatigue from all of those things that are going on. So I really want to make sure that caregivers are aware that if you are doing things that are just not characteristic of you, please reach out to somebody and talk about that, because we don't want you to become compassion fatigued or have this caregiver burnout where now your stress level is increased and you're starting to have some of those physical symptoms. Because now all of those things we talked about before, what if something happens to me? How do I keep my loved ones safe? All of those just become worsened and more in your mind if you're starting to suffer from some of this compassion fatigue or caregiver burnout. And when you're doing it 24 hours a day, 7 days a week, that certainly is a real concern that we have. So I wanted to at least make sure that I was pointing that out to people so that you were aware of what the symptoms look like and know that there is help out there if you're starting to feel that way. And some of my regular caregivers, ones I talk to all the time, who are pretty quick to reach out if they have things happening, I'm starting to see some of this in them, and they are not recognizing that. And so that's one of the things that I really wanted to make sure that we talked about today. So what can you do? So now that I've depressed you about how stressed you might be and all of these things that are happening, what can you do if you're a caregiver, that you're taking care of someone at home, your loved one's in a facility? The first thing I have to stress, and if any of you have ever heard me talk before, or if you've ever talked to anyone about caregiving, this information is not going to be new for you at all. It is the same thing that we talk about with caregivers every single time we talk to them. Take care of yourself and make yourself a priority. And I know that that is easy for me to say and very hard for a caregiver to do, to make yourself a priority. But I cannot stress enough the importance of doing that, and especially doing that now when you may not be getting those built-in breaks or your caregiving duties and roles have changed. Maintain a regular daily routine. We've already talked about that. Exercise, eat a healthy diet, get a good night's sleep. There is so much research that's coming out now about the dangers of not getting good sleep. So trying to get a good night's sleep is really important. Take time for yourself each day. And this, again, is what we talk to every single caregiver about. If you call me, that is one of the first things I'm going to ask you about, is what are you doing for yourself every day? How are you taking care of yourself every day? And I know that when you're sort of stuck, in quotes, at home with the person that you're taking care of, that's a really hard thing to do. So again, we sometimes have to rethink what that looks like. So taking time for yourself may not mean during this time that you're going out to the book club with friends or going for a walk the 2 miles that you're used to going. What can you do even for 10 minutes that just allows you to take some time for yourself? Maybe that's just shutting the bathroom door and keeping a book in the bathroom and reading a chapter of your book for 10 minutes. Or just walking into the kitchen and having a cup of coffee. We talk a lot about, for new parents to sleep when your child is sleeping or do all those things. It's the same way with caregivers. I always hear from caregivers, well, if my husband's taking a nap, then I need to be doing the dishes. Again, let the dishes go. They're not that important. Take that time that he's taking a nap to do something for yourself. If dishes are therapeutic for you, then that might be a good activity for you to do. I do know some people that cleaning house is therapeutic. I'm not one of those people at all, but there are some people who find that therapeutic. But do something for yourself. Write in a journal. Writing in a journal is a great way to get those feelings and emotions out. And there are no rules to writing in a journal. So you can write nice thoughts. You can write words that you would never say out loud to people in your journal. That journal is yours, and it's a great way to sort of get those thoughts and emotions out. Spend time with friends. And again, that may look different, but pick up the phone and call a friend or ask them to call you. I think friends often do not want to intrude, and so they're not sure if they should call. They're not exactly sure what your situation looks like. Reach out to some friends and say, hey, I would love it if you would just pick up the phone and call me and check on me from time to time. This has been really hard for me, and I may not think to call you, or I may get busy and not call you, but if you would call me, I would really appreciate that. Get help with some of your tasks. So, some of those things that you don't have to do, like we talked a little bit about, groceries, if you can get someone to deliver groceries for you, or shop online and just go pick them up so that you don't have to go into the store and spend an hour doing that. Get help with some of those day-to-day tasks. Join a support group or talk to a counselor or therapist. And probably one of the best things that someone can do right now, especially when they're sort of socially isolated from others, is to join a group, to talk to people who are going through the same thing that you're going through, even just to connect with them. Our support groups have looked very different since March than they have in the past. We always talk a lot about caregiving, but we also talk a lot about just the things that we're talking about, the increased stress levels. We talk about family members who are living in other states and how they're doing. So it's become much more of a conversational type group than really so much of here are all of these resources and help, because people really, they just want to connect with somebody. And that is probably the single most request we get when people call in, is just, do you have anything via Zoom that is just a socialization type thing? I feel like I haven't seen anybody and I just want to be able to connect with people. So joining a support group is also just very helpful for any caregiver, but especially during this time. And then how can you help? If you're not a caregiver, but you have a neighbor who's a caregiver or someone who goes to church with you who's a caregiver, how can you help that person? And again, reach out by phone or mail. Don't underestimate the importance of just a handwritten note. Hey, I'm thinking about you, sending you a hug your way. Email, just reaching out to them to let them know that you care. Maybe making specific suggestions. What we know about caregivers is they will not necessarily reach out and ask for help, even when they're struggling. So if you say, I would love to go pick up some lunch for you next week, Wednesday, and I will just ring your doorbell and set it there by the door so you don't have to see me, making specific suggestions of things that you can do to help them. Offer to stay with their loved one while they get a break, if you're comfortable doing that and if they're comfortable with you doing that. So keep those safe COVID-19 practices in mind when offering to help. They may not want someone coming into their home, but and to stay with their loved one. But if that's something that you feel comfortable with, especially if you're another family member and they're comfortable with you, then offering to give them a break, or just offering to sit outside with them for 30 minutes using your safe physical distancing just to have a conversation with them. But just reaching out. Caregivers, again, can be so socially isolated, and especially during this time. Just letting them know that you're thinking about them can make all the difference in the world. Sometimes that's, I've probably spent more of my time in the last couple of months just having conversations with people on the phone because they're just lonely and bored and they just need someone to have a conversation with. So it may not be that they have all these problems they want me to solve. They're just wanting to call and talk a little bit. So if you know a caregiver, reach out and help them to connect with someone. And then the last slide I wanted to show is just resources in the community for being able to do that. So the Schmieding Center resource website and phone number is on there. So as a caregiver, please feel free to reach out to us at any time. We are always there in the office answering phones. There's somebody there, and most of the time, if someone calls my number directly, I answer those phone calls 24 hours a day, 7 days a week. So if you call that number and my phone rings, I will get back to you. Family Caregiver Alliance is another great website that has just some resources and tips for caregivers, as well as the Alzheimer's Association has some great tips for caregivers. And again, Schmieding Center, we have the support groups available on Zoom, so please feel free to reach out. If our support group isn't the right one for you, we will connect you with other groups. We just want to make sure that we're connecting with caregivers and getting you the resources that you need during this time. And that is what I have for today. I don't know if anyone has any questions who's watching. All right. Well, thank you so much for listening to the presentation, and I hope that you found some useful tips and information.
That was wonderful, Brandi. Thank you so much for sharing all that information and your time with us today. I really appreciate it.
Absolutely. Happy to do it.
Right. Thanks. Have a great